Hi, I'm Gary White for Channel 6 Central Kentucky Television, and I'm here with Sarah Jo Best, who is the Public Health Director for the Lincoln Trail District Health Department. Today we're doing our interview at the Nelson County Health Center, which is part of the Lincoln Trail District Health Department. And we're here because you have recently unveiled a new logo that is going to be seen around all the different health centers. That's part of the Lincoln Trail District Health Department, right?
That's correct. As part of our strategic planning over these past couple of years, one of the areas that we've really tried to focus on is marketing and branding of the health department. And so one of the things that the team identified that they really wanted to change was our logo. And so we went through that process. The original logo was developed sometime after the health department formed in 1981, so it's been around for a while. And then we decided to launch the new logo with the new year.
Okay. So as of January 1st, you're going to see this new logo that we have here at the health center, health departments. But we want to also talk about why you decided to do this. Is because a lot of people don't realize that even if they don't go to the health centers that are located in each of the counties on a regular or ever, that they really are impacted by the services that are available through the Lincoln Trail District Health Department. Is that right?
That's correct. For a long time, we've struggled with the fact nationally that public health was one of the best kept secrets within our communities. And unfortunately, when you're a secret, people don't understand or the work that you do and what value that brings to the community. And so with this rollout plan, we are doing some marketing and some branding, and that's a little bit unusual for a nonprofit to do. But we're doing that because we need this community's support, we need policymakers' support, and we need the public to value our services in order to continue to utilize our services in a meaningful way. And so that's really what was behind this. Most of the services that are provided by the health department are not within the four walls of our health center sites. Everyone, our target population in public health is all. And so we serve Hardin, LaRue, Marion, Meade, Nelson, and Washington counties. We have a total population size or a total clientele of about 230,000 people.
Wow. And every one of those individuals has been affected at some point, most likely, because as we said, you can come to the health center and get services here, but there are also a variety of other ones. So let's kind of run through some of the different services that are provided by the health department in each of our counties. First of all, here at the at the Nelson County Health Center, but there are ones in Marion and Washington County as well, what kind of services are provided here?
So as I describe the services, what's important to note is that even when we do individualized patient services, public health is a little bit different. It's very different actually from private health care in that even the individualized services that we provide to the community are targeted at what that does for total population. So examples of that are we do communicable disease control. And so we may identify a case of hepatitis A in the community. That's something that's happened recently that's been in the news a lot. Tuberculosis, any of the communicable disease, anything that can be spread within the community. And we early identify that, we conduct investigations on that, and we may provide treatment or prophylaxis, whether that's vaccines, to those that were exposed to that. We do that to early identification and then control of that. So for an example, out of 100 cases we've seen district-wide of hepatitis A, 19 of those have been in the Nelson County area. Without public health working on that every day, that would have been much higher.
Absolutely.
Some of the other things we do, immunizations, again, aimed at not only protecting the individual, but creating that herd immunity. We need about a 90% immunity rate or vaccine rate within our communities for us all to be protected from communicable diseases that are spread that we have vaccines to prevent. We do environmental health services. If you need to originate those services, some of that comes out of here. So if you want to open a food establishment, or whether that be temporary or bricks and mortar, that process would begin here. If you build a house outside a municipal sewer, the process for an on-site septic system would happen here. And again, that program's aimed at protecting groundwater. So we have Women, Infant, and Children program, which is a nutritional supplemental program for those that qualify either because of nutritional risk or financial risk. We also have HANDS services that can be applied for or referred to through the Lincoln Trail District Health Department out of our health centers. That's early childhood program that focuses on normal growth and development and bonding between parent and child, which we feel is a huge strategy really to prevent future risky behaviors such as drug use that we're seeing in our communities. Nelson County is unique in that it's our only site right now that provides a harm reduction syringe exchange program.
Right.
And so we do that, again, to assist individuals, but also to contain outbreaks such as hepatitis C and HIV outbreaks that could occur in the community. So those are just a few of the services that we do out of this office, but there's so much more than that it'd take up your whole interview. It's a very holistic view. Public health and what we do is really based on what is the risk to the community. And so we look at what risks are to your health and safety, and we design interventions or use evidence-based, proven, efficient programs to target those. So our services will change over time as the risk determines.
Absolutely. Another thing that people maybe not realize that the health department's involved with, but they probably see almost every day or often, are the restaurant ratings as well. That if you see the numbers and the ratings, the A's or what have you around, they are done by somebody through the health department, correct?
That's correct. One of our inspectors has been there and inspected that facility to ensure that it's compliant with laws and regulations to keep you safe and the food that you consume safe. And so one of the things we do have the authority to set some local policy or ordinances through our governing board of health, and we received a lot of requests from the public to do that. And so that was a response from our board to public requests to make those available and to post those so that could be informed consumers going into restaurants.
Another thing that we've talked about in the past, and I know I've spoken with other representatives from the health departments around, Jennifer Osborne for Marion County and Nelson County and Washington County, are also like smoker ordinances. You've done some research on those areas as well and investigated the pros and cons and kind of helped with pushing that agenda as well.
Absolutely. Public policy is one of the most important and effective things we can do to change whole populations and their health risk. And so it's also one of the most controversial things that we do. But yes, smoke-free ordinances are something we are pushing. We supported a statewide smoking ban and that didn't pass. And so basically the strategy was to go home and do those locally. And so we have. We've done that in Hardin County. We've done that in Bardstown along with the officials, with city and county government officials and community partners. We're working on that in Marion County right now. We're working on that in Meade County right now. Next wave is going to be LaRue as well. We'd like to take it countywide in Nelson County. And then one day, hopefully, we'll be able to branch out into Washington as well. We also work with school systems and setting policy for that. And so we've worked very hard with our school systems to get our school grounds smoke-free. Not every school ground in Kentucky is smoke-free. So looking at that and how that affects total populations, one of the things we know about smoking ordinances is two of the first populations to stop or not initiate smoking are pregnant women and teenagers. So that's really an important population to reach. We also know that it has a immediate impact on the health and well-being of people that are breathing the secondhand smoke. We can see ER admissions go down immediately from that. And it changes social norms, so it makes it a little bit abnormal, and so that helps with decreasing initiation too.
Now, also recently here on Channel 6 Television, we had Rachel Briney on talking about the flu as well. So the health educators kind of go out into the community, and that's all through the health department as well, right?
Yes, that is. We have health educators that cover our area. We also have maternal child health educators that focus on maternal and child health issues. Everything from educating on the importance to car seats to policy-driven decisions. They do a lot of the groundwork and mobilization of community partners to make those policies happen. But they also apply for grants that sometimes are administered through the local health departments and sometimes they're not. Sometimes they're channeled through school systems or other community partners that we're working on shared goals within the community. So very important key people that you'll see in the community, but yes, they are definitely working every day to improve the health and well-being of our communities.
And I got a chance to work with several of them on the Safe Community Coalitions as well, the PATH Coalition, the WOW Coalition, and the Heartland Coalition in Marion County as well that have representatives from the health department. So all this is to say there's a new logo that's out there. So when you see this logo for the Lincoln Trail District Health Department, hopefully you'll realize that it's a large umbrella. that's
it's a
under
very
there.
large umbrella, and we hope that you see one of the things about the design of it is we really focused on the trail and what trails mean to communities, what trails mean to individuals, and we're hoping that this marketing and the awareness of public health and what we can do for our communities is really going to lead to a trail of better health for all of our community partners and citizens.
Absolutely. And again, I've been talking with Sarah Jo Best, who is the Public Health Director for the Lincoln Trail District Health Department. We're here at the Nelson County Center, but there are centers in Marion, Washington, our area as well, but you actually cover several counties throughout Kentucky. And when you see that logo, just remember that it's covering a whole lot of elements with public health, and that does kind of affect pretty much everyone every day.
Every day we work to keep our communities healthy and safe and look toward what we can do to make that so for the next generation as well.
Absolutely. Thank you very much.
Thank you.
All right, this has been Gary White for Channel 6, Central Kentucky Television.